Hey everyone, this is my second presentation for the last uh, presentation. So this is on the nutrition and health promotion. My name is Xiaoqing Wang and Joseph. So this is some objectives for this presentation, and this is introduction. Good nutrition is one of the primary determinants of the good health. Two major risk factors responsible for the global increase in obesity and other non-communicable diseases are unhealthy diet and lack of activity. So last presentation is about a physical activity and the health promotion. So two is connected. The role of the nutrition has expanded from a focus of nutrients needed to feed the population to its role in promoting health and preventing diseases. So promoting healthy diet and nutrition healthy of the Americans, the obesity epidemic is responsible for many of the health problems of the Americans, as well as the increasing cost of the healthcare in America. The incidence of the chronic disease in young people parallels the increase in the obesity rate in this population. American ranked prevention as the most important health reform priority. So dietary guidelines for the Americans. The dietary guidelines for American published every 5 years by the U.S. Department of the Agriculture and U.S. Department of the Health and Human Services. And the guideline offers dietary advice for the American aged 2 years and older, including the recommendations and other attached and other items. The dietary guideline for the American 2010 focus on encouraging the consumption of fewer calories, improving education on the food choices, and increase the physical activity while recognizing food preferences, culture traditions, and customs of diverse U.S. population. So my play is a visual cure for healthy eating habits. A lot of clinic has this picture. So you can find that on the internet, or you can look into the books. So issue in the nutrition, although the major problem in America is overnutrition, and nutrition is a problem in some segments of the population. Iron deficiency, a lot of finding in the pediatric patient. The world's most common nutritional deficiency is associated with the multiple health problems, eating disorders such as anorexia nervosa and bulimia, and the nutritional threats to the health of youth. Factors influencing eating behaviors: genetic, biological factors, food intake, and energy expenditure, controlled and kept in balance by complex neural systems. Obesity, a complex disease characterized by disruption of the pathway between the brain and the gut that regulate the hunger and the satiety, is the excessive accumulation of the fat in the various organs involved in metabolism. So considerable research is underway to understand the physiological and cellular mechanisms that regulate the allergy balance and the events that converge and result in obesity. So psychological factors: the most common performed human behavior are the eating, drinking, and making food choices. Although the simple behaviors, they are determined by many factors, including the individual psychological determinants, affective process, depression, low self-esteem, and lack of personal control over their own life influence nutritional practices. There are physical and social consequences of obesity, stigma. So socioeconomic and cultural factors: sociological, economic, and the cultural factor plays a dominant role in eating behaviors and nutrition. The relationship between the socioeconomic position and the consumption of fast food, such as the possible reason for higher level of obesity among individuals of low socioeconomic status and ethnic minorities. So environmental factors: our population preference of a healthy diet, large portion is influenced by the advertising, the food environment, and other obesogenic influences. So this environment also the surrounding opportunities or conditions that promote the obesity in individual and the population. For individual to make healthy food choices, healthy food resources must be accessible, available, and affordable. Health policy factors: as science advances, new health regulations are implemented and new regulations were added to dietary guidelines for Americans to reflect the change. So nutritional needs across the lifespan, here from the infants, so at 0 to 8 years, this is the guidelines. If you need the details, you can look into our books. and this is for the adolescents, 9 to 19 years. So this is a period of the biological and social changes, body size, composition, functions, and physical abilities changing rapidly. Moderation is the key. So for the adults, 19 to 50 years. So many of the eating behaviors and patterns of adults demonstrate once developing in childhood and adolescence, but caloric needs decrease when growth stops. So for the older adults, 50 years and older, so aging alter the nutrition requirement for the calories, protein, and other nutrients as a result of changing the lean body mass, physical activity, and intestinal absorption. So for the individuals aged 65 and older, recommendation is focused on decrease all those possible chronic disease like cardiovascular heart disease. So energy requirement decline with the reduction in the body size, lean body mass, basal metabolic rate, and decrease of physical activity. So promotion of dietary change. To alter nutrition patterns, all ages must be exposed to nutritional education through mass media, internet sources, education, school and work sites. Tailor self-help nutrition education packages, nutrition counseling in primary health care services or for clinics. Interventions to change eating behaviors. Intervention are evidence-based strategies implemented to change the unhealthy behaviors. Most interventions target the individual and may occur in the home, school, class, child care centers, and work sites. Intervention also target populations such as church, schools, and communities. So this is some research-tested intervention programs. We have 4 here. So help to better eating, to promote better eating behaviors and improve health. So the first one is a new move. New moves preventing weight-related problems in adolescent girls in group randomized study. So this study is aimed at preventing weight-related problems such as obesity, inadequate physical activity, poor eating behaviors, and unhealthy weight control practices, and body satisfaction in adolescent girls. Strong Women Healthy Heart. Strong Women Healthy Heart is a community-based intervention for sedentary, overweight, and obese women aged 40 and older, designed to promote dietary habits and increase physical activity to reduce obesity. The third one is intervention to promote healthy eating, regular exercise, and appropriate weight among firefighters. So the fourth one is Body and Soul. The Body and Soul intervention offers a unique opportunity to increase fruit and vegetable intake among African Americans. Strategies for maintaining recommended weight. Strategy including the following: choose sensible portion, watch your portion size, learn the healthy ways to make favorite foods, learn to regulate and control environmental cues that make you want to eat, have a healthy snack an hour before a social gathering, engaging in moderate intensity physical activity for 30 minutes every day. Strategy for initiating a weight reduction program. Individuals who are overweight or obese or desire to lose weight should consider a health care provider before starting an aggressive weight loss program. Definitely. So caloric reduction with attention to the portion size while maintaining adequate nutrition level is very important too. So the client must develop a new skills to facilitate long-term changes. Consideration for practice in nutrition and health. Health professionals are important role model for healthy eating and weight management themselves, and the responsibility for monitoring the nutritional health of individual, family, and the community is shared all the members of the health promotion team. Opportunity should be created to engage clients and others in dialogue about the dietary practices and change to improve. School nurses, occupational health nurses must work with school workplaces, industry, and policymakers to improve the food choices in cafeteria and vending machines. So opportunity for research in the nutrition and the health consequences of the overweight and obesity in America makes research a priority to identify and test new strategies and test them to reverse the trend. Research results indicate that the benefits of the dieting intervention had very limited success for sustained weight loss. The role of the physical activity as a treatment for obesity needs continued attention. Definitely, strategies to sustain weight loss also should be identified and tested. The complexity of the multiple factors involved necessitates a multidisciplinary approach and the involvement of the government officials and the health policy makers to make this happen. So this is my reference again, and if you have any question or any comments, please just leave below this presentation. And thank you for your attention. You have a very good week. Thank you.